Now, prophylactic antibiotic coverage before dental extraction, what are the situations where you want to do? We want to do it in rheumatic heart disease, prosthetic aortic valve, kidney damage on hemodialysis, patient on hemodialysis, you need to do. So typically, doctor, we have amoxicillin if he is able to take oral medication. Unable to take oral medication, ampicillin or cefazolin. And this is also very important. Children may, what is the dosage? What is the dosage of amoxicillin that you want to give? Don't forget, favorite question before dental extraction. 50 milligram per kg. You should not forget 50 milligram per kg. Suppose if he is allergic to penicillins or ampicillin, what do you want to give? Cephalexin or clindamycin or azithromycin or clarithromycin. If he is allergic to penicillin or ampicillin but unable to take oral medication, then what do you want to give? Parenteral, cefazolin, ceftriaxone or clindamycin. If it is cefazolin or ceftriaxone, 1 gram IM or IV. Barabar? So don't worry, all these slides, PPT slides are all available in the onlinembbs.com video library. No tension, right? You can always go back in onlinembbs.com video library. You have the quiz, video, PowerPoint, all the three are available. So you want to first play it like a game, you can play quiz. You want to listen the video, you can. Otherwise, you want to run through the PPT, you can run through. So there are 2 lakh PowerPoint slides, 30,000 MCQs, topic-wise revised, discussed. Last 20 years, we have no other job. MCQs, MCQs, MCQs. That's the only thing we had been doing. Right now. Now, what conditions prophylaxis is indicated? Prophylaxis indicated. And which condition prophylaxis not indicated? Favorite question of the examiner. Prosthetic cardiac valves, previous infective endocarditis, unrepaired cyanotic congenital heart disease including palliative shunts, or completely repaired congenital heart disease with prosthetic material during the first 6 months after the procedure. Any repaired congenital heart disease where there is a residual defect, any cardiac transplant recipient, or a rheumatic heart disease if the prosthetic heart valves are typically located. So they're all where prophylaxis is indicated is what you have to remember. Now once more, within the dental procedures also, all dental procedures do not require the prophylaxis. So this is the list of the dental procedures where prophylaxis for infective endocarditis is not required, is what you need to remember. Bacterial visitations, where do you see that? Typically we see in the heart valves, in the infective endocarditis. Now doctor, even rheumatic heart disease also we see. So rheumatic heart disease vegetations, infective endocarditis vegetations, non-bacterial thrombotic endocarditis, typically in the patients who are having any malignancy, you have a non-bacterial thrombotic merantic endocarditis. Merantic endocarditis in malignancy. Similarly, SLE patients have Ligman-Sachs endocarditis. Already pathology में हम discuss किया, फिर भी मैं और एक बार आपके लिए बार बार बोलो, हजार बार बोलो, ये बोलने की चीज है दिलरुबा. देखो, small warty verrucae along the lines of closure, that is rheumatic heart disease vegetations. Large irregular masses on the cusp of the valve extending into the chordae, that is infective endocarditis. Small bland vegetations typically attached to the lines of closure, one or many, that is non-bacterial thromboendocarditis. Then small to medium on either or both sides of the valve leaflets, or on the endocardial surface. That is Lippmann-Sachs endocarditis. So you have to be very sure about it.